Hi everyone, welcome to the awareness series by the Reach Clinic. We are a center for children, adolescents, and their families. We are a mental health care center. I'm Preeti Balan. Today I'm joined by Ms. Preeti Parekh, who's a consultant, the occupational therapist, and a certified sensory integration therapist at the Reach Clinic. She predominantly works with children having ASD, ADHD, and developmental delays. She does assessments for them and supports the parents with home management programs and provides guidance for them on how to deal with sensory issues in children. Hi, ma'am.
Hi Preeti, how are you?
Doing well, ma'am. Thank you. So, ma'am, what is occupational therapy?
Yes. So let me tell you, occupational therapy is a branch of healthcare
Mm-hmm.
that helps people of all the ages who have a physical issues, mental issues, cognitive issues, or sensory issues.
Mm-hmm.
They are paramedicals and they help the patient, okay, to
Mm-hmm.
regain the independence, okay, in
Mm-hmm.
all areas of life. They can go back to their own profession before any injury or any mishap. So
Mm-hmm.
basically rehabilitating the people, okay, after
Mm-hmm.
any mishap. That's the job of
Mm-hmm.
occupational therapy.
Okay. With children, how does occupational therapy help, ma'am?
Yes, see, in pediatrics, with the children, occupational therapists play a major important role. Okay, lot of children, okay, those who are pre-born or they have a lot of developmental problems. Okay, children with CP, autism, ADHD,
Mm-hmm.
children with Down syndrome, they have a
Mm-hmm.
lot of gross motor issues, fine motor issues are there, balance issue,
Mm-hmm.
coordination issues. They have a lot of sensory issues also. These
Mm-hmm.
children will have a difficulty in writing, holding the pencil, then
Mm-hmm.
focusing in the classroom,
Mm-hmm.
concentration, they are
Mm-hmm.
getting distracted. So in all this condition, the occupational therapist help the children.
Okay, okay. And what is sensory integration therapy?
Yes, the sensory integration therapy, to understand that, we need to understand what is sensory integration. So sensory integration is something how all of us process the information. We take in the information from our environment through
Mm-hmm.
our senses and
Mm-hmm.
within the body, from the body also, and how the brain process and respond to this information. Okay. If
Okay.
some children, say the children on autism or ADHD or LD, they have a difficulty in processing the information from the environment and also from within their body. If they
Mm-hmm.
have a difficulty in processing the information, they might process this information in a over responsive way or a under responsive way. In both the cases, there you see a lot of behavior, okay, in these children, and the learning is a difficult for these kids because of the sensory issues.
Mm-hmm.
So now
What are
what
the
I
red
want to tell,
flags? What are the red flags that parent can look out for?
yes, yes. So if the child is having a sensory processing issues or a disorder, what do you see in such children? These
Mm-hmm.
children may not look at you while you are talking with them. They may
Mm-hmm.
not respond to your name call. They may be very hyperactive children. They have
Mm-hmm.
a difficulty in sitting at one place, following the instructions. They may not be able to tolerate some sound. If there is a crowded place, if there is a loud sound, they might close their ears. Okay, they might get irritable. Okay, they
Mm-hmm.
cannot tolerate certain lights, certain textures. They have
Mm-hmm.
difficulty in wearing that texture, or some textures of the food also they have a difficulty. Okay,
Mm-hmm.
these
Mm-hmm.
children will face a problem in the classroom. They cannot focus, they cannot concentrate, following instruction from the teacher. Writing would be a problem to them. Okay,
Mm-hmm.
mingling with other children also would be a problem. They would get distracted in the classroom. All
Mm-hmm.
these issues are saying, okay, these children at home, parents might feel that they are not able to play. Okay, they might
Mm-hmm.
say, children would say, parents would say that, oh, they are not interested in playing. Okay,
Mm-hmm.
because child doesn't know how to play in a right way, in a meaningful and a purposeful way. Okay,
Okay.
so this also issue would be there. So these children might engage in some repetitive play. They
Okay.
might be just playing with one car. They would look at the rotatory toys. Okay, they would
Mm-hmm.
keep on looking at the wheels of the car. They might look at the fan, look at the
Mm-hmm.
movement of the fan. They might like to look at the vehicles which are moving. So the
Mm-hmm.
play would be more of a repetitive type of play. Okay.
Mm-hmm. Mm-hmm. Okay.
So
Okay.
when parents see this, okay,
Yeah. Yeah.
they would understand that the child is having a sensory processing disorder.
Okay.
Okay,
Okay.
some issues are there,
And
and
what
this
should
is,
they do in
yeah.
case they
See,
identify?
yeah, once they identify, they feel that, oh, child is having some of these issues, I feel they should not wait, they should take a professional help. Okay,
Mm-hmm.
they can go to the child psychiatrist or a developmental pediatrician, they
Mm-hmm.
can go to the occupational therapist, or these
Mm-hmm.
people might refer them to occupational therapist,
Mm-hmm.
because sensory integration dysfunction is a heavy burden on the child. Okay,
Mm-hmm.
child
Mm-hmm.
does not outgrow it without any help. These
Okay.
children do need a help, so they become a productive member of the society. They can learn, learning gets easier for them. The
Okay.
behaviors, the problem behaviors and learning are the outcome of the sensory integration dysfunction. So I
Okay.
would suggest to the parents, please take a help, go to
Mm-hmm.
the clinic, okay, and take a help of the professionals.
Okay. And what tips would you give for parents who are undertaking occupational therapy? What can they
Yes.
expect?
Yeah. So once they understand that the child is having some issue, diagnosis is done. When they go to the occupational therapist, what occupational therapist does, first the occupational therapist will do a detailed assessment about the child, because
Mm-hmm.
each child is a different, each child is a unique. Okay, the sensory issue of each child is a different.
Mm-hmm.
Okay, so the therapist will talk to the parents and try and understand that concern, where
Mm-hmm.
they are finding difficult to manage this child in the class, in the at home, maybe in the classroom setup the teachers are finding difficult, when they are taking him to park, at the mall. So in across the setup the child will have some difficulties. Okay,
Mm-hmm.
so once the therapist understand that, after talking to the parents, one caregiver questionnaire is given to the parents. The
Mm-hmm.
parents have to fill that questionnaire, come back to the therapist, then after that therapist will come to the conclusion, okay, and
Mm-hmm.
derive some hypothesis where the child is has a difficulty in processing. In which
Mm-hmm.
sense?
Mm-hmm.
Whether the tactile processing is an issue, whether
Mm-hmm.
there is a visual processing, auditory processing is an issue. What is coming in the way? Okay, why
Mm-hmm.
child is showing all this behavior? Why the learning issues are there?
Mm-hmm.
Okay,
Mm-hmm.
yeah.
Mm-hmm.
And
Okay.
once this is done, the therapist would suggest, okay,
Mm-hmm.
that they have to go for a sensory integration therapy. It is
Mm-hmm.
normally done twice a week or a thrice a week, depending on the need of the child. The
Mm-hmm.
therapist decides, and they
Mm-hmm.
have to start the therapy. Once the
Mm-hmm.
therapy is started, okay,
Mm-hmm.
the therapist will start working with the child in a sensory integration room. Okay,
Mm-hmm. Mm-hmm.
it might look like to the people that it's just the play. Okay,
Mm-hmm.
but
Mm-hmm.
it is not the play, it is much more than play. What
Mm-hmm.
therapist is trying to do is helping the child to process the information. So in the
Mm-hmm.
therapy room, during the therapy, the informations are given in a controlled manner, okay, so
Mm-hmm.
that the child's brain can process it slowly. Once the
Okay.
brain starts processing, therapist may give some more information, therapist may start challenging the child. Okay,
Mm-hmm.
and
Mm-hmm.
once this is done, therapy is done for some more time, and the
Mm-hmm.
parents will start seeing the changes in the child.
Okay.
Child will start looking at the parents, child
Mm-hmm.
may respond at the name call, his frustration tolerance may reduce. Okay,
Mm-hmm.
he will become more irritable. If
Mm-hmm.
he's going to the school, he would be able to sit in the class, he would be
Mm-hmm.
able to focus, able to follow the instructions of
Mm-hmm.
the teacher, and the
Mm-hmm.
learning happens. Okay,
Okay.
the
Okay.
child will start learning, academic
Mm-hmm.
goals will also move forward.
Okay. Okay. And
So these
what?
are changes. Yeah, go ahead.
Yeah. Whatever. In terms of occupational therapy, is it that only whatever happens in the therapy session impacts the child, or should the
No, this
parents be doing something at home?
This is really very good question, Preeti, you asked. See, it is not that the sensory need of the children are only for twice a week or thrice a week when they go for the therapy. Okay,
Mm-hmm.
needs
Mm-hmm.
are for throughout the day. So what I want to tell parents, wherever you are taking your child for the therapy, try to be there in the therapy room, what the therapist is doing with the child. Discuss with the therapist in detail about your child, about his sensory issues, his sensory preferences, what
Mm-hmm.
he's trying to avoid. all that parents should know that. Okay, try and get a good home program, or what we call as a sensory diet. Sensory diet is a activities which parents should be doing at the home, okay, throughout the day, to keep the brain regulated. If the brain is regulated, if the child is achieving the optimal arousal level, the brain of the child is in learning mode. Okay, child can learn. Child can learn new concepts. Child can learn academics. Child can explore environment. Lot of things will happen. So the parents have to work as a co-therapist. Okay. Either of the parent. Okay. Learn from your therapist. Discuss with your therapist. Okay. And do the things at home. Okay. If they are finding difficult to manage the child, again go back to the therapist. Discuss. Take the goals. How you need to manage the child at home. This is very, very important. If this is done, okay, at home, and the therapist does at the therapy center, you see a lot of improvement in the child.
Okay. Thank you, ma'am. Thank you for your valuable inputs. I think our parents learned quite a bit about occupational therapy today. So the crux of it is occupational therapy is a collaborative process between the parent and the therapist. It is not just what is happening in the therapy center. It is also what the parent takes away from the therapy center and implements back at home.
True.
Fine, ma'am.
Another thing I want to tell the parents, moment they see any red flags, don't wait. Early intervention is very, very important, because the neuroplasticity of the brain, you can make a changes. Okay, with the therapy, lot of changes can be made and the child can improve. So all the best to the parents. Whenever they see anything, please take a professional help.
Always reach out for guidance. Thank you. Follow our YouTube channel, The Reach Clinic.